Meet Dr. Jones, a busy pediatrician trying to make sense of the many studies and guidelines about the best screening tests for teens. Dr. Jones is a strong believer in evidence-based decision-making, but is often overwhelmed with the volume of published literature. Today, Dr. Jones is trying to determine whether Tyrell, a 14-year-old healthy patient in for a routine physical, should be screened for depression. Dr. Jones turns to the U.S. Preventive Services Task Force, or the USPSTF, guidelines for their recommendation because she knows the task force's recommendations are grounded in a thorough review of the scientific literature rather than the agenda or subjective opinion of a single author. Based on the USPSTF recommendations, Dr. Jones decides to screen Tyrell for depression. The RTI International University of North Carolina Evidence-Based Practice Center creates evidence syntheses, otherwise known as systematic reviews, to support national decision-making bodies such as the Agency for Healthcare Research and Quality, the U.S. Preventive Services Task Force, the National Institutes of Health, and professional medical societies.
Every year, more than 2 million medical research articles get published. For doctors, it is absolutely impossible to stay up to date without some form of knowledge management. So for busy clinicians, clinical practice guidelines and also other forms of knowledge synthesis have become important tools for staying abreast with new developments in medicine. At the Evidence-Based Practice Center, we create evidence synthesis that provide the basis for guidelines for doctors, but also for evidence-based information for patients.
The evidence reviews produced by our Evidence-Based Practice Center influence clinical decisions, policy initiatives, and future research directions. This not only makes Dr. Jones's job easier, but also makes Tyrell and his mother happy.